Then you'll see a couple more pictures of him. In life, there he is he goes to schools, and they're teaching people that just because the pet is disabled, his spirit cannot be broken. In life, there are always undesirable things. So in order to feel better, you just need to look at life from another direction. I hope this message will bring fresh, new ways of thinking to everyone, and that everyone will appreciate and be thankful for each beautiful day. Faith is the continual demonstration of the strength and wonder of life. So just because, I mean, you can see how much love that dog has. He's definitely, look at that, isn't that sweet? He goes to schools. So thank you, Faith, for teaching us all. And thank you again for allowing me to share that story with you. Okay, now we are coming to a very special spot in the show where we introduce our guests. And of course, we have a four-legged one, but we also have a very important two-legged guest. We have Dr. Kathleen Phillips from the Dog and Cat Veterinary Referral. It's a long thing.
I know.
Located on 197 in Bowie. If anybody's been in Bowie for a while, it's where the old post office used to be, which is right next to the new post office, which is right near where Millstream Drive intersects. So, anyway, so thank you very much for being here.
Thank you for having us.
Dr. Phillips, thank you. And on her lap is Rigley. Rigley, the Boston Terrier.
Yeah, he's a Boston Terrier. He is almost 5 years old.
Yes, and he is her baby, one of her babies.
One of my babies.
And then we have Glenn Bach, and he is here from Delmarva Search and Rescue. Thank you. Yeah, I have to remember, this is very long. Thank you very much for being here. My mind is really short. So anyway, I invited Dr. Phillips here because they have a very exciting practice at this Dogs and Cats Veterinary Referral. Can you, Dr. Phillips, tell me a little bit about the history of the practice?
Sure. Well, the owners, Dr. Kathy Arrington and Dr. Luis Brasrivo, they used to be located down on 450, and about 6.5 years ago, they purchased the building, and we actually moved in right with Hurricane Isabel. And we have been at that location for 6.5 years, and we've been growing ever since.
I can't believe it's been 6.5 years because I remember when you moved in.
I know. And it's been a long time now, but and just to think how much we've grown just in that time. We used to be very, very small. We've undergone expansion, added specialties, added equipment and staff, and we've become a quite large facility.
So what does your facility do? What kind of specialties do you have?
So it is a specialty hospital, so we don't do general practice, we don't do vaccines, and there's still your primary practitioner for that. What we do is primarily a specialty center. We have the specialties of cardiology, internal medicine, with which we also do oncology, and we have general surgery, and we also have neurology, and the neurologist also does neurosurgery, like brains and backs and things like that. And then along with that, we have the emergency service. And the emergency service...
That just started, right?
It did. We used to be emergency by referral only, which means your veterinarian had to call in first and tell us that they needed you to come. But exactly a year ago, we opened up to become a general emergency clinic. So we're open 24 hours a day, 7 days a week, every day of the year, and we have a doctor on staff 24 hours a day.
So now, does your primary vet still have to call ahead of time and register?
Not at all.
Excellent.
A lot of times they do, especially if there's a really sick animal. They want to tell us about the pet before they send it. But really, there's no calls that are needed, and a lot of them are much appreciative about that. It's less time on, they can just quickly get you out the door and get you up to our facility. And then, of course, the most important thing is when their doors are closed, ours are open. So we act as an extension of the regular veterinarians.
That is wonderful.
Yeah, and it's great. We really, we like to place a lot of emphasis on communication. So we like to make sure that we're constantly communicating with the general veterinarians and keeping them up to date on their patient, because some of their patients will spend days at our facility, and it's and you know, you form such a close bond with your general practitioner that they're very worried about your pet, and they like to stay up to date on what's going on. So we really try to do everything we can to maintain really good communication.
Okay, so now I think we have a, I have a photograph that you sent me, image of, if you can put one of the images up, and then Dr. Phillips can say what it is, because... Okay,
so that is our main surgery suite. That's in part of our new expansion. And you can see to the left is actually a window where you can see in from behind, and that's nice. It's just one of the hallways that we use, but it's a very large and spacious room where we can do a lot of different kinds of surgeries. Also in there, we have the ability to do like laparoscopy and thoracoscopy, which just means using the little scopes to go into the abdomen or the chest, and that's minimally invasive surgery.
Okay.
So there's definitely a lot of different things. We do have 2 other surgery suites as well. For when we need it, and one of them contains what's called a fluoroscopy unit, which is a kind of a state-of-the-art, it's like a video x-ray. And it takes real-time videos of things going on. We can do dye studies of your vessels and the heart and things like that.
Okay. All right, very good. I was very impressed when I saw that. I said, holy mackerel.
It's big.
That is very state-of-the-art. Okay, then if we can pull up the next photograph. Now, what is she doing there?
She is drawing up a chemotherapy drug. So that is what's called a chemotherapy hood, and it's constantly sucking up air into it, so it prevents any aerosolization of the chemotherapy drug. So you have to use very, very good safety measures when dealing with chemotherapy drugs. So she's got a mask on, a gown, and special chemo gloves, and you know, we treat that very seriously. And we do chemotherapy 3 days a week and do about 5 to 7 patients each of those days. So we do have a pretty good caseload.
Wow. Okay. All right. And then there's one other photograph that is...
So that is Dr. Brasrevo, and he is one of the owners and cardiologists. He is performing what's called an echocardiogram on a kitty, and that's essentially an ultrasound of the heart.
Okay.
And he, by using the images, and they take measurements, he is able to interpret exactly how the heart is functioning, what problems there are, and he uses that to then come up with a treatment plan to be able to manage heart disease.
Wow. I know I had a dog who, it was a Doberman, and this was many, many years ago, and he had a heart. He finally passed away from a heart, I forget what it was, but I took him, I had to take him to one of the, a very specialized place where they did a sonogram of his heart. Yeah, very, very, I mean, unbelievable.
It is, and you know, one of the things I've learned is cardiology is very much of an art. It's not only taking the pictures and figuring out what's wrong with the heart, it's managing the disease with a multitude of medications, and just seeing what he's able to do and how long some patients are able to live with serious heart disease is pretty impressive. Now,
I would like to just talk to you, and I want Glenn to interject also. There's so many emergencies out there, and I know, you know, when something happens to my pet, like, okay, what do I do? What happens, and what are the most common emergencies? And talk about maybe a little first aid kit that you may have at home. So if you can give me, say, maybe the most common emergencies that you have, and maybe go into what kind of first aid equipment a homeowner, a pet owner should have at home.
A lot of the common emergencies, a lot of times are things like traumas, hit by car, falling off of a deck, or you know, the little tiny dogs that jump out of your arms and will break a bone. In those situations, the most important thing is just stabilizing what has happened for the most part. You don't want to cause any further damage, but you know, if there's excessive bleeding, try to place a pressure wrap around it. But most important when there's signs of trauma is to get them somewhere quickly, and you know, wrapped in a blanket, something like that. We also tend to see a lot of what we call dietary indiscretion, which is consumption of something they shouldn't eat. And with dogs, it's typically human food, toys, towels, socks, clothing items. With cats, you often see string. That's the most common thing that a cat will eat, which can be very dangerous because it wraps up the intestines like an accordion. But the most important thing to know about something that a pet can get into is to save the packaging. If it is something like rat bait or even chocolate, which is very toxic to dogs,